This is a question I get perhaps every week of, I've got this little thing under my neck. Is there a way that you can liposuction this away? Or can I do some CoolSculpting? Or can I do a little Kybella? And I say, no, you can't do that. I've got to do a deep neck lift. And they're like, what the heck is that? So the problem with liposuction, the problem with Kybella and CoolSculpting are all the same problem. So it's not that I won't do any lipo contouring or removal in the neck, but it's with a lot of discretion. So if you have what seems to be fat in the neck, oftentimes it's not fat. It's actually deep. It's a heavier muscle. It is fat below the muscle and is a gland that is underneath the neck, underneath the muscle as well. And if you just suction the fat out, you really don't get much benefit. And so Kybella in the neck is really plus or minus. You don't get much difference with that, and it causes a lot of swelling for a short time. Now, at the same time, I use Kybella all the time to dissolve jowls. It's an injectable, if you don't know what it is. It's an injectable product from Allergan that helps dissolve fat. So if they've got an overfilled face with fat grafting, if they've got a jowl, and they don't want to do surgery or microliposuction, then Kybella works well. CoolSculpting is good for modest love handles in the body. I don't do this. I don't perform it, so I don't want to talk too much about it in the body. But in terms of neck areas, when you try to do fat dissolving in the neck, what you're treating is the fat that's sitting above the muscle, outside of the platysma muscle. And there's several problems with this. Number one is that fat is a coverage of the platysma muscle. So especially someone over the age of 40, if you try to remove that fat, you start exposing the platysma muscle underneath, and you can actually make them look older because you have those bands there. Then you force them to get a facelift because now you've got sagging bands that are visible, and that sort of turkey gobbler deformity has been created by liposuction. So that's a big, big problem. The other problem is oftentimes the fat is, as I said, deep to the neck. And if you just take that fat out without taking the glands out, you get what's called a cobra deformity, where you get over skeletonization of the midline. And then if you don't put the muscles back together, you get a really a big problem. So you either get no benefit or a problem. So as I told you, I do take fat out of the neck sometimes. And so this is the only time I take fat out of the neck is in rare cases when I may be doing a chin implant to add augmentation, and I notice a little bit of fat right underneath the chin that I feel as if that's causing a bulge that I could remove and improve. But I look at how much muscle there is. If there's a lot of fat outside the muscle, I feel more comfortable to take a little bit of it out. I always leave a cuff of fat over the muscle, but if I take the fat, pare it down all the way to the muscle, then that muscle, even if it doesn't show up within 5 years, in 10 to 15 years, I've just bought you an early facelift. So these are the reasons why liposuction, Kybella, CoolSculpting doesn't really work in the neck, or it causes problems. Now, on the other side of thing, the reason why Ulthera, Thermage, all those things don't work is either they're going to cause no problems or no issues, no improvements, or they're going to create an issue with over fat removal. It's going to be the same thing I just mentioned. In fact, a colleague of mine who works with Ulthera said it's great for a 30-year-old woman that thinks she has a problem but doesn't. So in general, these minimally invasive things for the neck in terms of fat dissolve or fat removal or fat contouring really don't work or can even be problematic.